Welcome back. Today let's continue about the dysfunctional pattern in spine movement. So last time we talked about the sagittal plane, spinal movement, or frontal flexion. Today we'll talk about the extension of the spine. So if I is gonna face again the wall, or if we break down part by part from the spine, part by part, so we go for the cervical spine, if we go for extension, so we have a range of motion up to 75 degree. Come back to normal. Then we go for the thoracic spine with extension of the cervical spine. We have a range of motion very minor if you compare it with the cervical, which is around 25-degree angle. Come back to normal. And if we move the whole spine part, cervical extension with thoracic extension, and we'll add the lumbar extension, which is 35 degree, we'll have a component of total 135 degree of extension to the whole spine. This is the norms or average. Of course, it depends from different from individual to another. Some people they have born by nature, so by nature they have a hyper flexibility, so they can move with more range of motion, but this is not the normal thing. So now let's see the abnormal stuff. Again, in the cervical spine, if you have tendency to drop, to lift your chin all the way up like this way, now you're doing something extra, which you called, come back to normal. Thank you. So this is hyperextension of the cervical spine. And this is very common in many poses. We'll talk about it later. And this will lead to a kind of injuries for the cervical spine. Of course, it will not happen from one class. Maybe it will be cumulative. After practicing yoga for several years, you start to have such kind of headache or such kind of pain radiating in your arms. And moreover, again, if you go for the thoracic extension, hyperextension, again, this is abnormal. You don't need to go for all this range of motion to avoid the risk of injury. And the most common injury is coming in the lower back, because we are trying to compensate the extension range of motion in the thoracic with putting more pressure in the lumbar. So we can go for hyperextension, especially if we go for D back bend. You find some people going for hyperextension in the lower part of the body, which is the lumbar, should be 35 degree, but no, we go exceeding this. And this put a kind of pressure on the vertebrae, will lead to a severe injury and serious one. So what our role in yoga is to avoid the dysfunctional pattern and just stick to the normal functional pattern to avoid any future injuries. Thank you for listening. Keep watching us.